Hi, my name is Jenna Roberts, and today I'm going to introduce you to a technique that could save many sonographers from developing a debilitating and possible career-ending injury due to work-related musculoskeletal disorders. Work-related musculoskeletal injuries are a widespread problem that is crippling the sonography workforce. By implementing a technique known as the Alexander technique, we could greatly reduce the chances of sonographers developing this type of injury. Would you be shocked if I told you that after only 6 months of scanning, 15% of sonographers report work-related pain, and after 10 years in this career field, 72% of sonographers are scanning in pain? Overall, 90% of sonographers report some type of work-related injury during their career. This is an astonishing number. These disorders affect the muscles, nerves, tendons, joints, cartilage, and spinal disc. This pain is associated with repetitive motion and strain injuries. For sonographers, these conditions are aggravated by workplace activities. Like many other medical professionals, for sonographers, time is of the essence. Sonographers find themselves conducting scans in a hurry with little regard for their posture. They often grip the transducer too hard and apply too much force. They are often conducting the same type of scans many times throughout the day and find themselves using repetitive body motions. Many times, in order to obtain an accurate scan, they are forced into awkward positions. As you can see in the image here, he has his body in a non-neutral position, his neck is extended, and his trunk is rotated in a non-neutral manner. This is a common way for an injury to occur. The back should remain straight to avoid an injury. Another common contributory factor is applying too much pressure while conducting a scan. This is often common when performing scans on overweight patients. With many offices overbooked, they are not getting adequate breaks between scans and are conducting scans back to back. In 2011, the industry standards for medical sonography acknowledged these problems. They finally decided something had to be done to help alleviate work-related injuries. The industry standards were updated to include ways to avoid work-related musculoskeletal injuries. The industry standards strongly recommends all employers have ergonomic sound scanning rooms and conduct regular risk assessments. Even with equipment manufacturers working tirelessly to incorporate the best ergonomics, the cases of work-related musculoskeletal disorders have not dropped. In fact, sonographers reporting work-related injuries have rose 6% in 12 years. It is clear that something needs to be done. This is where the Alexander technique comes into play. The Alexander technique is not a new technique. This technique was named after its creator, Frederick Alexander, in the 1800s. It is a process that was created to retrain the brain of bad movement and posture. Alexander believed that poor movement and posture habits had a negative effect on a person's overall health. The Alexander technique is a way to feel better and move in a more relaxed and comfortable way. The Alexander technique has been proven to reduce back, neck, and joint pain, such as that associated with work-related musculoskeletal disorders. This technique can also improve posture and reduce tension and stiffness in the body, which can prevent an injury from occurring. The Alexander technique has been proven to relieve stress and make a person feel less anxious. There are virtually no negative effects from learning the Alexander technique. Only positivity comes from practicing this technique. In 2007, a training session was organized for postgraduate ultrasound students. During this session, a qualified Alexander Technique teacher worked with individual students while they performed ultrasounds. The instructor taught students how to correctly hold the probe without using too much force or putting strain on their bodies. Upon completing the training class, the students were surveyed on the effectiveness of this class. The feedback from this class was impressive. All students found this session to be useful. This training class proves that sonographers would benefit from being taught the Alexander Technique. The best way to incorporate the Alexander Technique into sonography would be for the colleges to offer a class on Alexander Technique and require this as a prerequisite for all sonographer students. By doing this, we could prevent work-related injuries before they happen. If sonographer students are taught proper scanning techniques before they have a chance to develop bad habits, it is possible to significantly reduce the prevalence of work-related injuries in the sonography field. Learning proper scanning techniques after entering the workforce is too late. They have already developed bad habits that are much more difficult to break. If we include this program as a course in the sonography program, we can correct the problem before it is too late. Not only is preventing injuries the right thing to do, it is also more cost-effective. Employers are currently spending approximately $20 billion a year in workers' compensation claims. The cost of incorporating this program would be minute in comparison. In order to maintain what is learned in this program, it is recommended that employers offer all staff a yearly refresher course on the Alexander Technique. Training alone will not prevent work-related injuries for sonographers. Ergonomics alone will not prevent work-related injuries for sonographers. The Alexander Technique alone will not prevent work-related injuries for sonographers. But if we work together to ensure that all sonographers are getting an adequate amount of all three categories, we can significantly reduce the prevalence of work-related injuries in the sonography field.